If you are in your 70s, you might think a major open heart bypass is simply too dangerous and that a stent is the only safe choice. But did you know that for many older adults with heart disease, a major open heart bypass is actually much safer and longer lasting than a simple stent? Because if you pick the wrong one, you could be back in the emergency room within months. Hello, I am Dr. Rushabh Parikh. I am an interventional cardiologist specializing in structural heart therapies. Over my career, I have guided thousands of patients and their families through this exact incredibly stressful decision. You do not have to make this choice blindly. Let's break down what these two procedures actually mean, how to know which one is the safest fit for your body, and the exact question you need to ask your doctor today. Let's start by understanding how these two procedures actually work. Think of your heart arteries like the plumbing pipes in your house. Over time, these pipes get clogged with rust or sticky plaque. Getting a stent, also called an angioplasty, is like putting a tiny metal scaffold inside the pipe to prop it open and get the blood flowing again. It is usually done through a small pinhole in your wrist. A bypass surgery, on the other hand, is like hiring a plumber to install a brand new pipe that completely routes around the blocked area. It is a bigger open chest surgery, but it creates completely a fresh, clean pathway for your blood. So why does age 70 make this choice so difficult? Over 7 decades, the blockages in your heart often become hardened, calcified, and much more complex. If you also have diabetes or multiple clogged arteries, clearing out that hardened plaque is no longer a simple job. Plus, at age 70, your overall physical strength and energy levels play a huge role in whether your body can handle the shock of a big surgery or if a gentler approach is needed. With all of this in mind, how do you choose the right treatment? The truth is, your age alone does not give you the answer. The safest choice comes down to just 3 things: how complex your blockages are, whether you have diabetes, and your daily physical strength. Here is how that works. If your blockages are simple, a stent is usually safer, faster choice. But if you have severe diabetes and complex blockages in multiple arteries, a bypass surgery often gives a stronger, longer lasting result. And this is exactly why your daily physical strength matters far more than the year that you were born. An active 75-year-old might handle a bypass beautifully, while a frail 60-year-old might only be a safe candidate for stents. To make the absolute best choice, always ask for opinions from both specialties. Have both an interventional cardiologist and a cardiac surgeon review your case together. This ensures you get a truly balanced expert recommendation before making your final decision. So remember, there is no single right answer for everyone. For an older adult, the safest path depends on a complete picture of your health, never just on your age alone. If you or your loved one are facing this difficult situation right now, please do not rush. Before you decide, ask your doctor one question: can my case be reviewed by a joint heart team? That single conversation could probably change everything.